Hello, everyone. This is the Kiltz Health live stream with Dr. Nelson. I am your host, Dr. Nelson. And I have an echo here. Okay, I found it. uh, and let me just, I'm coming from Central Florida. Please let me know where you're coming from. And I see that I have a few people here: Bill, Jared, Bacon Runner, Terry. Hello, hello, hello. Uh, so we have a very special guest who is doing incredible work in the community health trenches. She graduated from Columbia University and Albert Einstein College of Medicine, and she's now unapologetically using proper human nutrition to reverse chronic disease in the sickest patients. Please welcome the woman known at the Meet MD as the Meet MD, Dr. Maria Chavez Santos. Dr. Maria, it's an honor to have you here on the Kills Health live stream. You talk about having faith in the patients and the rest of the medical system that the rest of the medical system has given up on. Tell us why is the ketogenic diet such a game changer for the underserved? And also tell us about why you eat this way and why do you think is probably the best nutrition for your patients.
Thank you for having me. I'm excited to be here. Yeah, so just a little bit about what got me into this. I There's a long history of cancer in my family, and for a long time I thought there's probably not much I can do about it other than routine screening. So a few years ago, around 2019, Dr. Perlmutter came and gave a talk at my previous employer where I worked in New Jersey. And he talked a lot about the link between a high carbohydrate diet and cancer. And that's initially what got me interested. And then I started doing a little bit more research and reading his book, and it really opened my eyes as to how I could use this actually in my own practice with my patients. Weight is a big issue, but more than that, I saw a lot of metabolic disease with diabetes, hypertension, and high cholesterol as a primary care doctor. So I started um, trying it out myself and seeing what would happen, and then sort of suggesting it to my patients. And I saw that as they started reducing their carbohydrates, their numbers started getting better. And I started going to the Low Carb USA conferences actually and seeing what other people were doing. And I picked up on a lot of skills that hopefully we can talk about that I use in my community health settings to be able to change things in people. And I've seen amazing success with it now with treating metabolic health. So much so that I think that's why now I'm so unapologetic about it because I see the drastic results.
Community health centers, I've worked in one, two, three, I think three of them, two in two in Massachusetts and one here in Florida. And I also, when I was a student in Puerto Rico, we are some of our rotations were in community health centers. Um, it's a little bit different type of medicine than other settings. Uh, what do you like about it?
Yes, it's my first time working in a center like this. So it's definitely very different from what I was used to before. I love that I'm helping a population that's often forgotten about. And more than that, I think people lose faith in this, in the patient population because they don't have as many financial resources and their education level is commonly lower. And so there's this misconception that because they understand less, they're able to do less and that you'll get less results. And I've actually found that to be quite the opposite. My sickest patients, my illiterate patients, are the ones that have done the best. So I don't think that it has anything, or that it does, I don't think that it rides solely on your financial circumstances, on your education level. I think you can make healthy changes if you empower patients and teach them. Just take a little bit of time to teach them. And so I have really enjoyed working with this population because I feel like they're the most receptive. The sickest patients want to get better the most.
So I've had that experience as well, and it's basically it's not that they just don't have the knowledge. Sometimes they are, I don't want to use the word ignorant, but ignorant basically means that they don't have the information, right?
Mhm.
So I'm not trying to be derogatory using that, but once they learn information that you provide, then they can be, they can respond to that. Oh, I can do this and I can do that. Uh, you mentioned cancer, and I made a note here because what do you think about oncology treatment centers, right after you have your chemotherapy or blood drawn, uh, they give you juice, soda, crackers, and cookies.
I think about that all the time. I mean, not just in the setting of that, but in any healthcare setting, when you look at those food trays, right? They're abysmal. And I wonder where where did we forget the basic science of cancer, diabetes? Where did we forget that? Because how is it that we're using PET scans to see where cancer is, which is essentially injecting sugar into the person and seeing where it travels? And we're then feeding them sugar. I don't understand the disconnect. And I think it's not on the patients to know this because if the providers aren't conceptualizing this, then how can we expect patients to do anything different? They're just following what we're telling them.
The disconnect is incredible sometimes, and I'll give you just a little example that I'm sure you probably have experienced. I don't know, in your family even, but every parent knows, every grandparent, every uncle knows that if you feed a bunch of sugar to the little toddlers and the 5-year olds, they're going to be running around,
Hmm.
and it will change their behavior. It's going to make them hyperactive. They're going to be
Yeah.
climbing the wall sometimes. But okay, if it changes that behavior, how can that it change other brain chemistries? And we've learned now. I've met you now twice in a low carb conferences, and we've learned about metabolic psychiatry and
Hmm.
metabolic theory of cancer and all these things. And we've seen how anxiety, depression, bipolar illness, schizophrenia, all kinds of mental health disorders and neurodegenerative disorders improve.
Absolutely. Absolutely. I've actually had really incredible turnarounds with that, where I mean, I this is why I've become more emboldened in how I practice. I had a patient last year that I met. Her brother moved her to California because she had terrible dementia and schizophrenia, was on a lot of psychiatric medications for it. Sure enough, the first time I met her, she was nonverbal. So she did not participate in the conversation. Of course, a raging diabetic on a bunch of blood pressure medications, cholesterol medications. I mean, it gives me goosebumps every time I think of her because in the past 6 months, she is a new person. We joke around, we have conversations. She did not have schizophrenia. She did not have terminal dementia. She was metabolically ill and it was making her brain sick to the point where she could not speak. And now she is a normal person. And in fact, about 2 visits ago, when I saw her, she came in to see me because she had fainted because she was following the diet so well that she was still, and she was still taking her blood pressure medications. She didn't need them anymore. Her blood pressure was going too low. I had to take her off of her blood pressure medications, and her diabetes is much better. But she's just a functioning person now, and she has taught me a lot about what I need to do and the kind of faith I need to have in people, and the power of food as medicine.
So blood pressure going down is a very frequent thing, and sometimes we overlook, the bad blood pressure. You had to stop taking the medication. So we talk more about reversing uh, the diabetes, or treating brain disorders or cancer. But this is almost I said, because it's not 100%, but almost universal, that someone who follows a strict, very low carbohydrate or carnivore diet, the blood pressure gets better. I was taking 300 milligrams of metoprolol a day
Wow.
and lisinopril 40 milligrams. Okay. And I going very strict keto didn't make much of a difference on the medicine. But when I went carnivore, uh, seven about 7 months later, I passed out, and I remember the day because it was the day of my birthday. So the day before was the last time I took any blood pressure medication, and the other day I wasn't feeling well. I had a little cold, so I took my blood pressure. It was 122 over 71. So I have been off blood pressure medication now for 3 years because my birthday was earlier this month. So it is satisfying as well as a physician. I know, to have someone go off their medications because they don't need them anymore. I want to point out a comment here. This must be someone that follows you, or Jared DeMoss. Can't wait for this one. Dr. Chavez Santos is amazing.
Thank you.
Uh, all right. All
Yes,
right.
that's such a compliment. I love being able to help empower patients, and so it's always a compliment when they can see it. But more than that, I want patients to be able to see that they're amazing.
Well, that's not the only one. Big Apple Montessori. She's the best doctor, compassionate, extremely knowledgeable, and really cares for her patients. I love her.
Oh, thank you. I do. I think I really do care about people, and I think that that comes across when I talk to them. And that's the whole reason that I go to these conferences. I think it's my job to stay up to date, to stay informed, to stay critical, so that I can digest what I've learned in a way that people who maybe don't come from the best backgrounds, who don't have all the resources available to them, can pick and choose how they can modify their life over time so that they feel more in control of what they're doing with their lives. And people really have taken it to heart, and they've run with it. And as they feel more empowered, I feel more empowered to be able to teach them, what I learn.
All right. So we have a question for you here. And if you have any questions for Dr. Maria, just put them in the chat, please. Put QQQ in front of it so I don't miss it. I almost missed this one. Uh, so let's see. And this is cookie cutter. Does the ketovore carnivore diet help with the prostate and also poor circulation? Dr. Maria.
Yes, yes to both. I starting with the poor circulation. Um, I mean, that's kind of a general term, but I think really what you're talking about is probably vascular disease or venous or arterial disease. And what causes that is inflammation and buildup of plaque. And if you want to just simplify it, what causes that is a diet that's likely very inflammatory, high in carbohydrates. So as you reduce that, you can improve vascular disease, which does improve circulation. Um, I don't have as much experience with specific or as much background in terms of what specific studies for the prostate, but I do remember a couple conferences ago, somebody was talking about this and how it does help with symptoms of BPH, benign prostatic hypertrophy, which is where the prostate grows as men age and causes problems with how they urinate. And so I've encouraged patients to see how it works for them. And a lot of people do feel an improvement with that. I know there are studies behind it. I just don't know them off the top of my head.
All righty. Uh, this is, we mentioned cancer, of course. Dr. Seyfried and his people, his team, if you email him about this type of cancer or that type of cancer, he has a package of information that he sends out, and he has a few of those that are specific for specific cancers. He has a little package for the prostate cancer. I know that because someone consulted with me about prostate cancer. I turned around and asked Dr. Sifri. He sent me his package. His email is very easy to find. Just look for Thomas Seyfried. Uh, I believe it's Boston College, and they answer
Mm.
within 2 3 days usually. So they're very responsive to the. All right. So let's talk about the community health population, and you tell them lower. I'm assuming this is what you tell them, but I'm pretty sure it includes stop the ultra processed foods, stop the seed oils, the refined sugar, right? Eat real food. Uh, you know, if they, uh, I doubted that on your first conversation, you tell them stop all the vegetables, eat only meat. But so
Hmm.
if they're gonna eat real foods and a few vegetables and meat. Now, sometimes a lot of people make excuses about eating this way. It's too expensive,
Yes.
right? But it is very expensive to be on 15 or 20 medications and being sick because of something that you can change, which is mostly sometimes the food you eat. So, how do you go around if they say, well, I don't know, I can do that because it's too expensive?
Right. I think I start off by saying, I see you're on a lot of medications, and I'm wondering if you'd be interested in talking a little bit more about how we can use food to help you get healthier. Most people, I would say 99% of people say yes. So that's me assessing where they are. Just like quitting smoking, where you can't reach everybody all the time 100%, not everybody's ready. I first have to see if they're ready, because if they're not ready, as much as I want them to change, I'm not going to be able to do so. If they do say they're ready, it also kind of preps them mentally in a way that, yes, they actually do want to hear about things. So they're telling themselves, yes, they're ready. And so we go through what foods are maybe not healthy, and also what they should be eating, because a lot of people think, well, the doctor's just going to tell me to cut this and that out. But and it's true. A lot of doctors, though, don't know what to tell people that they should be eating. They just say, "Eat
Eat
low-fat whole
healthy.
grain." Yeah. "Exercise, I'll see you in 6 months," or "Eat low-fat whole grain." I used to tell people all the time that. Why? Because that's what my preceptors in residency told me to say. I didn't know what that meant, right?
And
And
that's what the
so
United States guidelines
yeah.
called for.
Yes.
Low fat, more grains.
And there, here we are pushing more and more medications on people. So I make it, I frame it around one, empowerment, right? Are you interested in learning how you can change things with food? And most people nowadays, thankfully, want to reduce medications. So I'm touching on that aspect too of, can we minimize, can we decrease the amount of medications you're on, if not completely eliminate? And then assessing the readiness. So once we have the whole conversation about what foods are good and what foods are bad, and I explain to them very basic science, just in a way that's digestible to them, then we talk about, well, this is a lot. I'm telling you everything because I want you to know it all, but not because we're expecting you to change everything. However old they are, if they're 45, you've eaten this way for about 4 decades. We're not going to change it all. What I am going to ask you is, as we've talked a little bit, I'm asking you to brainstorm what 2 or 3 changes you think you may want to make over the next 3 months until your next set of labs. That way, it gives us 2 or 3 concrete goals, and I'm not telling them what to do. They're the ones that are brainstorming, and they're the ones that are coming up with their own plan. A lot of people will say, "I don't know. I'm not really sure. I think I need to stop all the bad stuff." So I push them more. Okay, what's the bad stuff to you? What is it to you? Until they come up with an answer. Because I think it would be a lot easier to say something like, "Okay, good. That sounds great to me." But that's not a goal. That's not tangible. That's not anything that they can use to measure their success. So whether it's, "I want to be able to surf," we're in Southern California, or I want to be able to eat less tortillas and maybe a little bit more meat. And then going back to that question about it being too expensive, because they're coming up with their own plan, they know what they can do. So it's, again, me, it's not me telling them. I can give them suggestions if I see they're really struggling. I had a guy this past week who's having he has really limited funds, and he's having Progresso canned soup. And I said, "You know what? Keep the canned food. Keep the canned food if that's all you can buy. But how about we switch from canned soup to canned tuna? Do you think that's something you can do?" And he said, "Oh yeah, sure. Is that's okay?" And I said, "Absolutely." So just something small. I think the most important thing is that they come up with their own plan, because only they know their day-to-day life.
You mentioned you mentioned tortillas. I was born and raised in Puerto Rico, and our staple is multiple times a day rice and beans, right?
Hmm.
And it's rice and beans with a side of some other starchy food, with a side of another starchy food.
Yes.
Uh, and I've lived in New York, Massachusetts, Florida, and I've worked in about 7 or 8 states. And usually, uh, Hispanic patients in general, Puerto Ricans more specifically, gravitate towards where I am. So I have found myself seeing patients from Mexico to the tip of Argentina, and if it's not rice and beans, it's tortillas. So telling a Puerto Rican don't eat rice and beans is really hard, and telling anyone from mostly Central America,
Hmm.
they have, and I don't think I'm exaggerating. I've had people tell me I have up to 15 tortillas a day.
Oh yeah, easily.
That's easily probably an average. So how do you deal with that if they tell you, okay, I cannot be without my tortillas? or my rice and beans. Uh, how do you approach that with patients?
I love this question. And I think this question is an important one for providers. I I've learned patience and I've learned to have faith in people. And I really have had to reflect on what that means because the reason we're so quick to give pills is that we want a quick result. We want it with good intentions. We want patients to get healthier faster, right?
Mhm.
But I have come to learn, patients have taught me this, is that it's okay if I don't see your numbers completely reverse in 3 months or 6 months, but we will get there. And so, what it comes down to is you, as the provider, having faith and patience in the person that you're talking to, right? So that you're not expecting these quick results. If you're telling me I can do 10 tortillas instead of 15, I consider that a success. That's it.
Definitely, definitely. You sometimes you have to negotiate, barter, and do all those things with patients
Yeah,
because you have to meet them where they are, right? You
that's right.
cannot impose a set of rules and expect them just to follow blindly. Uh,
That's
but you,
right.
but you can guide them. What is the most common myth your patients uh, believe before they start when you teach them about proper human nutrition? What do you think is the most common myth or misunderstanding?
Fat is bad for you. Fat causes high cholesterol. Eating fat causes heart disease. That is number one. And two, it's funny. I did a news interview a few months ago with a local news station here, and one of the questions the interviewer asked me is, it was about diabetes. So diabetes, that's horrible, right? It's an incurable disease. And I said, no, it's not. I would have to say that's the second one, that these metabolic diseases, once you're on medication, once you have them forever. And that I would say those are the top two.
Yeah, that is definitely a common belief, and unfortunately, for many years, I was promoting that same thing
Mhm.
until I learned, wait a second, I can reverse diabetes. So once I did that, one of the first questions to my diabetic patients in particular would be, do you know that you can reverse your diabetes?
Yeah,
And most of the time, the answer is no. But interestingly enough, I did find a few people that say yes. Okay, so the conversation will go down different routes with that.
right.
But so you personally, and you do recommend basically a meat heavy diet.
Yes.
What is your favorite hidden gem for affordable meat in the community health setting? And I have a inkling that you're going to mention the canned tuna because you already mentioned it. But what is your favorite hidden gem to recommend when people are concerned about the price?
I know that's a big one. Besides canned products, yeah, I try to see where they are. First of all, I ask where they shop so that I can make some suggestions. Um, Eggs kind of fluctuate, right? But in terms of meat, I tell them, look, you don't have it. Obviously, I would love for you to eat grass-fed uh, beef. um, but even if you can get some ground beef or whatever it is you like, that's ground, that's cheaper. I'd rather you have that than 20 tortillas or a sack of rice. Um, and so I kind of try to see what their tastes are. Most people also, the fats that they're cooking with are important, which centers a lot around meat. So a lot of people are using vegetable oils. So in this community, especially the where I practice, a lot of Mexican patients. they have seen pork fat being used. And so I'll ask them, well, do you think maybe you can use pork fat instead of, your canola oil? Yeah, I think I can do that. Avocado oil can be expensive, or, butter can be expensive, but somehow pork fat works. So, I try to see stay culturally sensitive, and then see where it is that they're at financially. Some people just can't do. Some people also. I have a lot of homeless patients, and so for them, the canned foods are the way to go. They don't have
Or,
access to a refrigerator.
well, I was going to mention that it's not only the price, but they don't have, and they can buy big volumes as well because they have to be carrying their food, right?
Hmm.
In most instances. So, but canned sardines, canned
Yes,
tuna, canned
chicken.
salmon, chicken, beef.
Hmm.
Would that be my favorite food to go, to have first? No, but this is the emergency food that I have in my pantry because if there's nothing thawed and ready to cook, hey, corned beef, the cans
Yes.
of corned beef, sardines. I have all that stuff in the pantry.
That's right. And I have Dr. Tro in his Toward Health website has a
Mm.
handout on how to eat healthy on a budget. So I've printed that out for people as well. And he says a lot of these things too. Um, I I tell my patients, I baptize them with a handout every time they meet me. And it has a list of foods that I've put together over the years from the conferences. And so that's part of my little Bible, my food Bible that I give them before they leave.
Um, yeah, a lot of people have very good resources available online, and I too use many of them. Besides nutrition, what is the one lifestyle habit that most improves a patient's metabolic health?
I mean, the obvious answer is exercise, because especially, I mean, cardiovascular exercise for obvious reasons, right? You're exercising the most important muscle of the body, which is the heart. But I love recommending weight training for people. A lot of people with mobility issues who can't do cardiovascular exercise or high impact workouts. Weight training is the way to go. And you can be sitting in a chair, in a wheelchair, and do resistance band training or small weights. And usually, what I'll tell people is if you want to boost your metabolism, you have to have muscle. Muscle is where your resting metabolism is. Um, and so definitely exercise. And it's important also with that to meet people where they are, right? If they love running, great. But if they hate it, they're never going to do it. If they love Zumba, wonderful. Go ahead and do that. And I think obviously it also boosts your mood, right? And when you're feeling well, you're motivated to eat better. And so it's not one thing or the other. It's definitely a combination of things that are symbiotic.
Yeah, for many reasons, many of the patients, if you just tell them, oh, you have to exercise more, you know, most people might be at a point where they can't even get up. And when you tell them to go exercise, they're thinking about you either have to go outside running or go to the gym, right? But they can
Right.
have it's not, even a person that may be in a wheelchair can have some weights around, and like you said, use a stretch band or some exercises sitting. Maybe they can get up, and it is very strenuous to get up once. Well,
Hmm.
that might be a high intensity training for them.
Right.
Try to get up twice, and you're done for maybe that session. Do it again as soon as you can, and that's where you start. uh,
That's right. Yeah, again, it's all about meeting people where they are, right? Would I love for
Yeah.
people to go fully ketogenic or carnivore in 3 months and be exercising, 4 times a week? Absolutely. I am not expecting that. And in fact, you mentioned, telling people this or that. I really try to be mindful about telling people anything. My job is just to give them information, and after I finish that, I'm very conscientious about how I frame it. I say, okay, so now that you know this, what are we going to do? It is never on me to tell them what to do. It's always their choice. It's always going to be their plan. So now they know, right? Every 3 months we talk, they know how we work, right? So I say, okay, so what's the plan? What's the plan for the next 3 months? And as people get to know me, that they know that that's what works, and it's worked for them very well.
You want them to not to think, but you want it to be their idea of what they're gonna do.
Yeah.
All right. Uh, Cam's dad asks, "What do you think eat better is?"
I love that question. I'm a big proponent of answering a question with a question. I usually, if we were sitting face to face and somebody asked me that, I would say, "What do you think it is?" Right? Invariably, people say, "I think I should eat more fruits and vegetables, more whole grains, less red meat, less fatty food." And so for somebody who answers me that way, I usually say, well, let's think about it. Let's think about the science. And we go through what would be healthy and what's not. And obviously, we're doing this talk. So what I propose to people is, well, carbohydrates cause inflammation in the body. They do lead to heart disease by increasing your cholesterol. Carbohydrates trap salt in the body. They increase your blood pressure. And they cause diabetes. So for me, anything that's the opposite of a carbohydrate diet is what I promote as eating better. How that looks to each individual is different, right? We're talking about cultural differences. We're talking about financial differences. Education, I don't think matters because if I give people the knowledge, like I've said, I've had patients who cannot read, and those are usually the patients that turn it around the quickest, which has been a pleasant surprise. But leaning into animal products is the bottom line. Leaning into animal products and away from anything that's human made. It's funny, I one of the patients I recently talked to, I could tell he understood very little, and he I actually asked him what he thought diabetes was because he has diabetes. He couldn't answer. No one had ever taught him what diabetes was. I said, how about this? When you go food shopping, ask yourself this question. Does it come from an animal? If the answer is yes, you buy it. The answer is no, you don't buy it. So we practiced and until he got it. It took about 10 tries, but you want to simplify it. And to me, better is, does it come from an animal?
All right. So let's take some questions here, and let's see. Let me take this first. Thank you for the super chat, uh, John Betty or Beatty. I do not excuse my accent. Uh, Thank you very much for the super chat. I have a sister who's 68 and has type 2, um, assuming it's type 2 diabetes, for 7 years now. Her name is Anne. He called her out. Can you please let her know she can reverse it? She won't listen to me, only her diabetes doctor. Thank you both.
I wonder if her diabetes doctor tells her that she can't reverse it. I think, you know, I'm grateful that a lot of patients do appreciate and honor what their doctors are telling them, and I'm wondering what her doctor's telling her. And again, I would go back and if you're listening to just what is diabetes? If I were 5 years old And you were to explain to me what is diabetes, what causes it. If you put it very simply, it's eating too much sugar floating around in your bloodstream. So if that's what causes it, then wouldn't you think that maybe eating less could change that a little bit more? Especially with type 2 diabetes. Talking about type 1 diabetes is a little different. But just understanding the basics of it, I think, is important.
Dr. Maria, is this something that you and I believe and we are isolated in this belief? Or is there proof that you can reverse your diabetes? Because that,
Absolutely.
yeah,
Yes, yes, yes. I mean, if you want to go into the science of it, yes. And for anybody who does want to discuss it, I always do. But
okay.
here's what I ask people. If what you're doing is working, why are you still on medication? Why not try something different? And then maybe in 3 months and 6 months, you can come back and tell me, doctor, what you said was completely wrong, right? You can be the proof. And thankfully, I have the proof to back it up, anecdotally in practice, right? But also scientifically. So to me, it's not about belief, but there's no room for belief here. Um, I deal in science, I deal in medicine, and I'm very passionate about this because the science backs it up and because I see it all the time in practice and
Yes.
people see it all the time.
So, absolutely, John. You can clip this or send the whole YouTube video to your sister. You can reverse diabetes. I have seen it multiple times. I can name you some of the people that are in this chat because many are in the Kiltz Method tribe. Uh, so I know some of their stories, and they can reverse it, and they can put it there. And so, thank you for the super chat. And yes, the answer is yes. And if you want, if she says, "Well, show me," well, besides the thousands of anecdotes, look for the Virta Health Study, which was,
Mhm,
I would call it a landmark study, I think 2017. And I think they reversed that diabetes in more than 50%,
mhm.
decreased medication in over 75 to 80% of the people. I mean, amazing results. And I think Dr. Tro and his people also have a little bit,
Yes.
few studies. So yes, there is also proof, and so no, it's not a chronic, incurable, forever progressing disease, which unfortunately is what Virta with a Virta, and he's asking me. You know, when I talk at meetups that we have, I always tell the story that if anybody doesn't understand me because of my accent, in 2018, I had a stroke and it gave me a funny side effect. I developed a Spanish accent.
Mm. I love that.
I was born and raised in Puerto Rico. That's where it comes from. All right. This is a comment, not a question, but it's important. Uh, Faith focused food freedom. Karen uh, is a Kiltz certified health coach, and this is why she's making this comment. Thank you. This is an excellent recommendation for us coaches, also, because we, among other things, we talk about motivational interviewing, which is basically the approach that you're using with the patients. And as a coach or as a physician, you want them to come up with a plan and supply
Mhm.
them some information, but it is uh, them that they have to get better and even want to. If they don't want to, you stop there because they're not ready.
Yes, and the other part of it is going a little bit beyond this. This is makes the visits a bit more complex. Is a lot of patients want to, but they just can't figure out how to do it. And so when I see patients struggling with that, it's not that they lack the knowledge because we've already talked about everything. But when I see them struggling, I go back to a really basic question and the question is why? What's your why? Because if you didn't care, if you lacked motivation, you wouldn't be sitting in front of me right now. You would have missed your appointment. You could have easily not scheduled a follow up. What is bringing you back to this office? What is keeping you taking your pills? Why? What is your why for trying to manage this? Most people, it's I I don't want to be in a wheelchair when I'm old. I want to be around for my children. And so getting them to verbalize that is important because it's not always lack of knowledge, right? It's getting them to remember what their purpose is in doing this. And it's hard to do that when especially in a community health setting, right? You have 15 to 20, you're given 20 minutes, but by the time you get in the room, you have 10. And so trying, just chipping away at it a little bit and reminding patients why they're doing this and them giving you the response, right? I think is really powerful. And again, going back to having the patients to not need to see drastic results right away. Most people will have great results, um, but not everybody needs that in that moment. And having that patience is really important.
All righty. So Cam's dad asks Dr. Santos, any experience in high dose melatonin? I've been doing it for 7 weeks. I have meds to my liver. He's been carnivore for 3 years now.
Mm. I don't have experience with that. I don't I can't speak to that. I'm wondering mm, no, I can't speak to that. I don't know
All
if
right.
Dr.
There
Nelson, you
there
do.
is there are, and I even read a book about this, I forget the name, but there are a lot of current prescription medications and over the counter supplements that have been repurposed or have demonstrated some uh, advantage in using them in cancer patients. And uh, I guess this is why he's asking, because
Mhm,
melatonin is one of those. By the way, things as simple as loratadine and metformin
mhm,
have also been shown some benefits in cancer treatments, but uh, not your area of expertise, nor mine specifically, although we do deal with patients with cancer all the time. And I have personally experienced uh, way in the past, because it was almost 3 years ago, doing good. Anyways, uh, let's see. By the way, going through treatments, I did a lot of fasting before and
mhm,
after my treatments. I was checking my ketones. I was using a number of natural supplements that have been proven to have an effect in inhibiting the glutamase uh, enzyme, because glutamine, if you've listened to Dr. Seafried, obviously glucose, glutamine, and some other stuff kind of feeds the cancer cells. Anyways, uh, if you have any more questions for Dr. Maria Chavez Santos, we're coming to the end of the live stream in a moment. Uh, okay, I do have another question here. Let's see. Based on the limited time you have with patients, do you recommend that practices have health coaches to spend more time with patients.
Yes, I do. I think if facilities have access to health coaches, it I think it's helpful on many ends. Coaches can spend more time with the patient and more frequently speak with them. I know a lot of coaches give patients direct access to them so that they can be in regular communication. Something that I can't always do for my patients, although I always tell them, look, if you have any questions about food, I love talking food. So just use the patient portal to send me a question, and I'll respond to you as soon as I get it. We don't have access to that where I work, and so I'm the health coach. But I feel like we think it's burdensome, but it's really not. I mean, I love talking food, and so we get to do it every 3 months with each person, sometimes a little bit more frequently, but it works. Obviously, you'd probably get more drastic and quicker results with the benefit of a health coach, but we're still working on that. I'm hoping we can bring that to my current employer. I think we're in talks about that.
Yeah, I think that would be a great idea. And Karen, like I mentioned, she's one of our Kiltz certified coaches, but she is, uh, I think you're retired, right? She's a retired nurse, so she was a registered nurse for a long time.
Mm.
Um, okay, is Dr. Santos a T2 doctor? I'm assuming he means type 2 diabetes doctor. Uh, Go ahead and answer that question. What kind of doctor are you?
I'm a primary care doctor. I'm trained in family medicine. So that means I am trained to from birth to death. So I'm trained to deliver babies, although I don't currently do that. And I'm trained to do pediatric care as well as adult care of all ages. Where I work right now, the need is more in the adult community. And so I'm seeing mostly adults. And unfortunately, there's a pandemic of metabolic disease, including type 2 diabetes. So I very much am a diabetes doctor, but I'm hoping over time my patients and I can change that. And so, yes, I am. There are other doctors called endocrinologists who solely focus on diabetes, but my specialty is everything, is family medicine.
And I am partial to family medicine doctors, having been trained as a family medicine
Mhm.
doctor. So I think it's the greatest specialty, and I'll argue about it with anyone. There's a, I'm gonna mention the name, but there's someone famous. Actually, there are a couple of things, couple of doctors who are internists both, and they always talk about internal medicine being the best specialty. No, they're wrong. It's family medicine.
Absolutely. Absolutely. It really is. And it's so much fun because we see such a variety of patients. I truly enjoy it.
All right. So let's see. There's another question here from Cam's dad again. Uh, have you seen carnivore or carnivores having lower WBCs?
WBC stands for white blood cell count. I haven't. In my experience, I've seen some carnivores have other lab differences, but not an effect that I have seen on their white blood cell count. And so many different things can cause fluctuations in that.
Definitely. And if you remember, he said that he had metastases to the liver, which
Hmm.
basically means he has stage 4 cancer somewhere from somewhere.
Hmm.
And that by itself can be a reason for uh, the white blood count to be high.
Right.
So with cancer, it can be high, it can be low,
Hmm.
uh, it can be normal. It can have an effect. Different cancers do different things. All right. So this is just a comment. Hi, John. I'm in Daytona, if you remember. Don't know if you've been my patient.
And
So Daytona is the same county as I am.
Mhm.
And I've worked around here for a long time. I've been 30 years in Florida. Um, all right. All right. So if anyone wants to contact you, what, where would they do that?
My Instagram is probably the best way if you have a Instagram. It's Meet MD, MEAT MD. Yeah, the Meet MD. Obviously, I can't provide any personal medical advice. If I'm not your doctor over the internet, but I'm happy to, talk food just because I love talking about it so much.
Mhm.
And I am in the California area in San Diego. I practice in Carlsbad. And so if you look me up, you'll find me on the internet, and I would love to partner with you to help you stay healthy and help you be healthy and help you see that you can keep yourself healthy. I think that's really the most important thing. It's what gives me professional purpose. I love what I do, and I tell patients this all the time. Seeing you feel empowered and change your life is what gives me satisfaction. And I'm so lucky that I get to be witness to this. Usually, we chat, we sit, we have a conversation. Okay, what have you done? What do you want to do? Let's talk food. I hear, patients teach me too what they're experimenting with, what they see. And it really is a lot of fun to help people. And what's interesting, I think, going to the back to the overall topic of this conversation is the sickest patients, especially with diabetes, the sickest patients I've met, and I've practiced. I trained in I went to medical school in the Bronx. I trained in a very rural part of New Jersey. I lived in Princeton and very close to New York City. I practiced as well. So I've seen a good variety of patients, culturally, socioeconomically. The sickest patients I've seen is here in California, and the people that have really taken to heart what we talk about and turned it around the most have been here. And who would have thought that, right? That if you have a little bit of faith or a lot of faith in people, and if you can teach them how to uh, help themselves, that they can do it and they can teach others around them to do it. And so I'm seeing that as well. And so would love to have people come to see me and talk food anytime.
Thank you very much, Dr. Maria. Thank you for the incredible work that you're doing and for being so unapologetic in your mission to heal. You're truly empowering the underserved. Everyone, please follow Dr. Maria on the Instagram. We showed it. I'll show it one more time. It's the Meet MD. And you have a great day, everyone. At
Thank you.
5:30 today, we have our Kiltz Mighty Tribe Zoom call. We'll be there in an hour and a half. Everybody, have a great day.
Enjoy. Thank you.